Hey everybody, welcome to session number 3 of Dr. G's AMA, or Ask Me Anything. So this week I want to handle the question of what is the difference between IBS and IBD. Both sound very similar, right? They both have IB in their name. They're both digestive dysfunctions or diagnoses that a lot of people get from their doctors. But a lot of people just don't really understand or know the difference between them. So I'm going to break it down for you guys, hopefully make this easy to understand. So we have IBS, irritable bowel syndrome, and we have IBD, inflammatory bowel disease. So both of these in a nutshell have something to do with, changes in bowel patterns. So, in many cases, right, people having diarrhea, can be some constipation, we'll get into that, but changes in bowel habits, so your bowels are not normal, and abdominal pain, so pain in kind of the stomach, abdomen region, right? And it's worth noting that if you have changes in your bowels and you have abdominal pain, one of the things your doctor or your gastroenterologist is going to do is try to see whether it's IBD or maybe it's IBS. Okay. Well, also there's a third one for abdominal pain and change in bowel habits, and that's celiac disease. We're not really going to focus on that, and estimated to affect about 1% of the population. There are also going to be a number of other more unusual conditions that have some of those symptoms as well, but we're going to stick to IBS and IBD. So let's do IBD first. Okay, inflammatory bowel disease. Now, there are really two principal or main categories of IBD and a couple of other little ones, okay? So the two main ones are Crohn's disease and ulcerative colitis. So these are autoimmune diseases where the immune system is attacking the digestive tract, okay? Ulcerative colitis, so if we break down that term, we have ulcers, right, which are raw like wounds. Colitis, is the colon, right, or large intestine. Itis means inflammation, so it means an inflamed and ulcerated, wounded colon, right? Now, ulcerative colitis always starts low, where the lesion begins, usually low in the large intestine, kind of near the exit, if you will, right? And when it gets worse, it proceeds upwards in a continuous line. Okay, so in other words, if it starts here and it ends here, it's going to be continuously the full length of that lesion. This is one of the differentiating characteristics of ulcerative colitis. The other important thing about ulcerative colitis is that it doesn't penetrate through the wall of the bowel. So it can really hurt the bowel, right? That whole section that we said can be raw, ulcerated, inflamed, in pretty bad shape, but it won't ever actually penetrate through the wall of the large intestine. So what happens, right? You have this raw ulcerated colon, which is going to give someone diarrhea, and it is going to give someone, when the disease is active, blood. This is the type of blood like someone sits down on the toilet, they look down into the toilet bowl and they see red blood. Now, typically only a couple of reasons that someone is going to see blood in the toilet bowl. One is, bleeding hemorrhoids. The other is going to be fissures, like tears in and around the anus, basically, and ulcerative colitis or its relative ulcerative proctitis are typically the main reasons that someone's going to see frank blood in their stool. Also could be colon cancer, but less likely that that's an issue, okay? So the main symptoms of ulcerative colitis are pain, diarrhea, and bloody stool. In contrast to that, we have Crohn's disease. So Crohn's disease, ulcerative colitis, autoimmune disease of the digestive tract, basically the colon. Crohn's disease, autoimmune disease of the digestive tract. But in Crohn's disease, it can affect any part of the digestive tract. So from mouth to all the way to the other end and anywhere in between can be affected by Crohn's disease. So again, makes it very different from ulcerative colitis. Also, the lesion, it can skip around the lesions. So remember we said ulcerative colitis, if it's here to here, it's going to be the entire length. Crohn's disease, you could have one here, one over there. It can skip around, okay? And this is what makes Crohn's disease more dangerous than ulcerative colitis. Crohn's disease can penetrate through the wall of the intestines, right? So instead of just being, on the inside, like you just scratched up the inside of your hand, but the outside is okay, like it is the case with ulcerative colitis, Crohn's can actually punch a hole all the way through, eat through the wall of the intestines. And that's bad news, right? What's in the intestines is supposed to stay inside the intestines and not get out. And so this can lead to the formation of pus pockets, right? Where the immune system, you get a little perforation, a little hole in the wall. The immune system swarms in, right, to help prevent infections from spreading throughout the body, and it seals it off, and you get a big pus pocket that forms. If it isn't able to seal it off, you can get something called sepsis or blood poisoning, which can kill you. Right? You can also, because of all this damage on the outside of the intestines, you can actually get the intestines sticking together. So you can get what are called adhesions, where the intestines are sticking to other intestines or sticking to the walls, the inside of the abdomen, right? And that can cause a whole bunch of problems. And you can get lots of scar tissue formation happening inside the intestines, which can lead to blockages and other bad things. So ulcerative colitis is the more dramatic typically because people are having lots of diarrhea, they're seeing lots of blood, it looks worse often, right? But Crohn's is actually the worst disease because you can get these perforations, these holes through the intestines, and in worst case scenarios, people can get blood poisoning and die from that. Where the most commonly, the side effects of ulcerative colitis are typically going to be anemia, like from blood loss, right? And fluid loss. Now, there's some other things. We're not going to get into all of that. Those are the two main types of IBD. The third type, which, there's a little bit of debate, is called microscopic colitis. So colitis, again, an inflamed colon, but microscopic meaning when you look at it, with the naked eye, or you put a colonoscopy, right, a camera into the colon and you look around, you typically don't see any problems. But if you do a little biopsy, you take a little piece of that colon and you look at it under a microscope, you see the problems, right? So it's called microscopic because most often you only see it under a microscope. You don't see it when you're just looking at it with your eyeballs or just a regular camera, okay? And so with microscopic colitis, it's more going to be an issue with diarrhea than not so much the bleeding that happens in ulcerative colitis. So in IBD, we have these three main types, a couple other little ones that we're not going to go over right now, but mainly ulcerative colitis and Crohn's for people. It is called a disease because it is something that is easily identifiable, right? You will have antibodies. If we look in the blood with an IBD test, they'll do a colonoscopy, they'll see the damage that's happened to the intestines, right? In contrast, IBS is an irritable bowel syndrome. So whenever doctors are using the word syndrome, it basically means they have not pinned down what's going on, right? It's not called inflammatory bowel syndrome, it's called inflammatory bowel disease because we see the damage, we see what's going on, we see what's causing the symptoms. Right. In contrast, irritable bowel syndrome, the conventional community is still largely stumped about what's causing people to have irritable bowel syndrome. So when they go in and look with a scope, they see, everything looks fine. If they take a little microscopic biopsy, right, to look at it, they see it looks normal. Right? It's called no pathology, no tissue changes, no damage that they can see, no antibodies that are easily identifiable as far as what's going on. Okay? So the symptoms of IBS are still the same. So IBS typically falls under three categories. You have IBS-C, IBS constipation. You have IBS-D, IBS diarrhea. And you have IBS-M, irritable bowel syndrome mixed, right? So typically someone's either going to be constipation dominant, that is they have pain and discomfort and they're mostly constipated. They're IBS-D, they have pain, discomfort, they mostly have diarrhea, or they have IBS-M where they go back and forth between constipation and diarrhea. So it's important to note that IBS is for the most part a junk drawer diagnosis. That is, you're going in complaining of bowel changes and abdominal pain, right? And they scan you, they scope you, they run some blood tests on you, and they don't find any disease, right? You don't have IBD, you don't have any of the other, you don't have celiac disease, you don't have anything else that's likely causing this. And so guess what? Now you have IBS, right? IBS, in a sense, is not that helpful of a diagnosis because it doesn't tell us specifically what's going on. Now, we're not going to go into this, but a lot of IBS is caused by SIBO and some other things, right? We in the alternative community have a decent sense of what's causing quite a bit of IBS. So if you have it, get in touch with us. We'll help you out. All right, so that is this week's session number 3 of Dr. G's AMA. What is the difference between IBS and IBD? IBD is inflammatory bowel disease, Crohn's and ulcerative colitis. IBS is irritable bowel syndrome, right? And that's either IBS-D, C, or M. At the end of the day, these are just diagnoses, right? Diagnoses are helpful. We don't throw them away. They can tell us some of what's going on, but they don't define a person, right? If you have IBD or you have IBS, you will have some things in common with other people who have IBS or IBD, but the disease, the way it manifests, and what's going on for you are all going to be different. The strengths of the conventional system are that where they do a good job, they're very helpful for people, right? They can help control the diarrhea, they can help control some of the pain, they can help with some of the issues that are going on. Where they fail is they treat everyone the same, right? And they don't take individualities into account. Your IBS or your IBD could be quite different from someone else's. Effective treatment for you could be quite different from effective treatment for someone else. If we can help you, please feel welcome to contact us. It's www.aspirenaturalhealth.com or facebook.com/aspirenaturalhealth. That's facebook.com/aspirenaturalhealth. We focus on gut dysfunctions and autoimmune diseases, as well as hard to treat cases. We don't give up on patients, and we're always working to get better. If we can be of help to you, please feel welcome to contact us. Until session number 4 of Dr. G's AMA, take care, folks.